Hello everyone, welcome to our next lecture on the Introduction to Human Anatomy. So in this lecture we'll cover the abdominal-pelvic quadrants and the abdominal-pelvic regions. So the abdominal-pelvic quadrants first. Now the reason that we're going to do this is because in the abdominal cavity, like you can see in the image here, there are a ton of organs to keep track of. And so sometimes what physicians and anatomists do is they divide the abdominal pelvic cavity using planes into regions or quadrants to kind of keep track of what structures are in what locations, um, and help us understand things a little and compartmentalize things a little bit more. So the simplest way to do this is just to take two imaginary planes, a vertical one here and a horizontal one here that you pass through the umbilicus, through the navel or the belly button, to create these four quadrants, break the abdominal pelvic cavity just into four regions, we call quadrants. So you have a right upper quadrant, you have a right lower quadrant, a left upper quadrant, and a left lower quadrant. And sometimes people use the abbreviation. So right upper quadrant would be RUQ, right lower quadrant would be RLQ, left upper quadrant would be LUQ, and left lower quadrant would be LLQ. Now, basically what I want you guys to be able to do from this slide and this PowerPoint is actually pretty simple. You should be able to identify these quadrants. If I put a number here, say identify the region number 1, you should be able to, and I put the 1 here, you should be able to tell me that this is the right upper quadrant or the RUQ. So you should be able to identify your four quadrants. The harder thing is to be able to identify certain, specific organs in these particular quadrants. So like, the liver is mostly in the RUQ, the gallbladder is entirely in the RUQ, the spleen is entirely in the LUQ, the appendix is entirely in the RLQ. And then you got things like, the urinary bladder, which is in the two lower quadrants, the intestines, which are basically in every quadrant, the liver, which is mostly in the right upper quadrant, but portions of it in the left upper quadrant, and then stomach also, which is mostly in the left upper quadrant, but small portions of it in the right upper quadrant. Okay? So kind of focus on things like that. Basically, just the ones that I explained, sort of in general. Yeah. So the more complex way to do this is to, instead of just putting two lines that, a vertical and a horizontal that go through the umbilicus or through the navel or the belly button, you basically put a tic-tac-toe of planes over the superimposed on the abdominal cavity. And when you do that, you get 9 regions. These are your abdominal pelvic regions, right? This is not 4 of them, so we wouldn't say quadrants for these. These are regions because there's more than 4. Okay? So you can see them here, your right hypochondriac region. So you can break this one down to help you remember it. Hypo means below. Chondria refers to ribs, like anything chondro refers to ribs. So this name kind of literally means below the ribs. So right hypochondriac region, epigastric region here in the middle, left hypochondriac region here, right lumbar region here, which can also be called the lateral region, the umbilical region in the middle, left lumbar or left lateral region here. And then you have your iliac region or inguinal region, so right iliac or inguinal region, hypogastric or pubic region here in the middle, and then left iliac or left inguinal region down here. Inguinal means groin, so this is kind of in the groin area. Okay. So again, I could put a number on any one of these. You should be able to tell me which one is which. Okay. And then, like I said, the other thing is, what organs are in what places. So like, liver is going to be in the right hypochondriac and the epigastric regions. The stomach is going to be in the left hypochondriac and the epigastric regions. The spleen is entirely within the left hypochondriac region. Intestines are going to be basically a little bit in all the regions. The appendix is in the right iliac or right inguinal region. Urinary bladder is entirely within the hypogastric or pubic region. Okay, so things like that. with emphasis, on the organs that are solely in a particular area, like the appendix, the bladder, or the spleen. All right, so quick question. This will show you kind of, aside from identifying the different regions, kind of a question that I might ask you. The urinary bladder is found in the blank. Okay? Where is the urinary bladder found? Okay? So urinary bladder is going to be found in D, the hypogastric region, or sometimes called the pubic region.